blogging and things like that. And I think as a doctor, when you're in kind of private practice or at the hospital, everything's on autopilot. The patients come. But when you're in hair and, there's a lot of competition and it's really sales driven, you've got to be more than just a doctor, and you have to do just a lot more stuff, blogging, writing constantly, doing things like podcasts, just to get the interest level.
Sure.
And really credibility that people demand, because when you're changing somebody's cosmetic, especially hair, I mean, it's like gold to them, and it's limited as far as how many hairs you can move. Mm-hmm. And so I always feel like I'm handling your gold, and I'm going to make it work for you. I think my approach, and we'll get into this soon, mm-hmm. People feel safe, and we don't do guarantees, but, I don't have any bad reviews because we always make people happy, whether we add grafts or do other things to build up the density. So, which is great.
Yeah. Excellent. Okay. So let's get into the hair a bit.
Yeah.
So, there's tons of commercials out there for different products, and I think every day on the internet there's some other kind of like magic device or pill that you can take. So realistically, what are the most common misinformation you see being put out there right now about hair and hair restoration?
I think the biggest thing is that, people feel a sense of shame that they're actually coming to get a consult. Many, just because of the old plugs and mm-hmm. the old connotations of people that, had some work done that was not natural looking.
Right.
And, I think that's the biggest fear is it going to look natural? And am I going to regret this? I think that's the biggest hurdle people need to get through. I think the second one is just the whole concealment thing. I mean, this is very private, and we encourage, our current patients to, if they know somebody and they feel comfortable to refer, we appreciate referrals from patients. It doesn't happen much because people don't even want to talk about it. And the other thing is they don't want a huge ordeal where they have to take a couple weeks off to heal from a hair transplant. I mean, we've got, owners of companies, CEOs of companies, people in sales. We have average people that, husbands, wives, but they have, big social activities going on. So it's not all glamour and glitz. It's not all high profile people that get this done. I mean, there are a lot of people that, we work with financing wise, or we do smaller multiple cases so they can, get it done in a budget that works with them. So, the biggest thing is, hair is when you have it, it's awesome. When you don't, it's a real bummer. Mm-hmm. Yeah, and it's not a medical thing, but it really affects people, confidence wise, depression wise. I think there are plenty of studies out there that show that, people with hair loss, maybe don't have the advantages that people that, that have hair, whether it's dating or possibly even, job selection, things like that. So, all of this plays into people's psyches. So what I've tried to do is come up with really a stealth way of doing hair transplant where I'd say probably 80% of our patients, we do what's called a shaveless procedure where we don't have to, really give anybody a weird haircut. Mm-hmm. We can work with the hair that's already there, do grafting around the long hair, and then when we move it up, we actually take it from the back and sides of the head, and then when we move it up, we do a lot of things to just conceal the grafts and just make it seamless. So they don't have to take a lot of time off.
Sure. So, okay, Is that a painful process? So like you said, from the back of the head, so like, back toward like I guess like your neckline? Is that like, do you have to numb someone to do that? Are you just like, you cutting your skin, or is it you like just basically kind of like plucking the hairs out and then replanting them? And I know this is like the most like layman's non-technical terms.
Yeah. Well, I'll just start out by saying that I have not written pain medications for 18 months post-op. Okay. So, not narcotics, maybe like a nerve pill occasionally. So the post-operative course is not a painful thing. All right. So there are two, at least the way I do it, there are two ways of doing hair transplant right now. One is to make an incision, sometimes from ear to ear in the back, and then they'll cut out about maybe an index finger width of all the hair and pull that entire strip out and then sew the edges together. And the bummer is that people get left with a linear scar. Sometimes there's numbness and pain. It can be a tough post-operative course, and then other times it's very easy. I don't do that approach. What I do is I get single follicle groupings, either one hair all the way up to 4 hairs with a punch. Usually it's about 0.85 millimeters to 0.9 millimeters, so it's really small. And we just take random hairs. So those hairs have to be short when you graft them. So we just cut those intermittent random hairs, leave everything else long, extract the hairs using a punch. And then they get implanted using these pens. It's basically a stick in place. So it's really directional. I can lay it down or have it stand up or go left and right. And when you throw in, ones up front to soften the hairline or the sides, and add more volume with 2s, 3s, and 4s to get more density, that's how you get a natural look. It doesn't look pluggy. And the directionality is key. So every graft we look at not only, how it's laying, but there's also an arc to the hair. So you want all the arc to be headed down, towards the head, not, some going to the left, right, or up. And when you can get all that in sync, having the arc in all the, the right dimensions, it's very natural, almost indistinguishable. Now, it's really hard to get entirely full density just because you're going to be, putting in so many grafts, and it becomes a cost thing. And the other thing is, how much hair do you have to donate back there?
Right.
So, you have to be, but there are certain densities that work up front and in the back that we can spread things out.
Sure. So this process, is it primarily then for, let's say, like receding hairlines and thinning up front, or is it also like if you're thinning up top?
Yeah, anything. So, the crown is, kind of the proverbial yarmulke in the back, So, a lot of people just have that. About 15% have like just pure crown loss with no receding hairline. And then, the typical male pattern is going to be receding hairline back, and then, the crown starts to, and they're like big puddles that come together. But, a lot of it depends on how old are you, how coarse is your hair, like how thick each hair is, what kind of density do you have, what's your family history. So, it all kind of plays into what prescription we recommend. I mean, if you're 20 years old, really balding, and you have a strong family history, you have to be really careful and go conservative, because they're going to hate you in about 20 years when everything else falls out and they just have this lump of hair in the front of their head. The younger people, I'm more cautious. We have some medical things that we do. We inject platelets and even fat into the scalp to generate hair growth, and do some medication management, laser light management as well. So it's not all hair transplant.
Yeah. Okay. So with that, are there before somebody would get to the hair transplant stage, Rogaine is the most common thing to hear about, but are there like in your professional opinion, are there products that if somebody is just starting to lose their hair or starting to get a little thin that actually do work and are not just marketing gimmicks?
Yeah. Well, most of the marketing products, whether they're, vitamins or things that you put on the scalp, are what are called clinically proven. They're not scientifically proven. Mm-hmm. And clinically proven means that you don't have to get FDA approval for what you say.
Okay.
But it can't be like so outrageous that it's you're lying. Most of the commercials that you see on TV, they'll say clinically proven to, bring back hair or restore hair. And I really don't recommend those products. I'll tell you the best thing that I hear people say is, I think it works. And they literally just keep using it because they want it to work, and they're scared if they stop it, then, and sometimes they pay hundreds of dollars a month. But I have not had a single patient tell me, this is awesome, you need to do it on every patient. So I used to sell products and actually stopped. I just don't want to be a salesman. I don't want to say, try this for 3 months and come back, because I've done it, and it's a bummer. People want to start the process, and they feel like they just kind of wasted some money. So now scientifically, Rogaine is scientifically proven. There are a lot of studies. The only thing with Rogaine is you have to take it continuously, because if you're on it, off it, you'll get into shedding. So you can actually not permanently lose hair, but you'll shed hair, mm-hmm. which can be a bummer. And then people think, oh, it's causing me to lose hair, so they stop it. But if you use it continuously, it's got to be twice a day. It is effective, and that's scientifically proven. And then the platelet therapy, which is called PRP, platelet-rich plasma injection therapy, we don't have a lot of studies, but there's a ton of clinical information. I've seen some really amazing improvements through the years. I've been doing it for hair since 2012, and it's one of the most common things I do. And we just recently started doing fat, which it's too new in my brain to figure out, the effectiveness. And there just aren't a ton of studies in hair on PRP and fat, but every doctor who does hair restoration does PRP just about.
Okay, sure. So, yeah. So like cost-wise, PRP, you said it's PRP, right? PRP versus like the actual implant, or not the restoration part. What's I know it's going to be depending on a lot of different factors, but is there like a ballpark one versus another?
Yeah. Well, the PRP, varies. There are different concentrations. Different clinics have you come back like every 6 months and do like 4 or 5 treatments to build up the growth factors. I hate doing multiple procedures on people, and I've had actually 5 or 6 PRP injections on myself, and I feel like it's really helped. But it's not the most pleasant thing to go through. And so I wanted to come up with a treatment that was, longer term, we were just going to really hit it hard with concentrated PRP and not have to do all these procedures to get a result. So we take 120 cc's of blood. Now, keep in mind, a pint of blood is 400, so it's not like a massive amount of blood. Yeah. But a lot of places just take 20 cc's of blood and spin it down. So they're maybe getting concentrations of about 2 times body concentration, and we're probably about 6 to 8 times body concentration. And we get a lot of PRP, so we can really do the whole top of the head. And we mix a medicine called ACELL, ACELL, which is a stem cell attractant, and it's called a micromatrix. So it works with the PRP, and we do a maximal dose of that. So we've had people that have had, 24, 36 months of improvement with one injection. In a lot of other places, it's kind of a yearly injection doing, lesser blood. So And there are different machines and different centrifuges, but we have a double centrifuge that we use to get it really concentrated.